Hello, I'm here to talk to you today about the impact of addiction on relationships. And first of all, let me introduce myself. My name is Leslie Rowan, and I'm a licensed marriage family therapist. I'm also in long-term recovery. And I would like to talk to you today about addiction and the impact it has on both the addict and the relationships in the addict's life, personal as well as professional. So first of all, what is addiction? According to the American Society of Addiction, addiction is a primary chronic disease of the brain's reward, motivation, memory, and related circuitry. It's characterized by an inability to consistently abstain from addictive substances and behaviors that impact the life of the addict as well as those around him. Addiction is widely recognized as a disease of compulsive drinking and using, which can be arrested but never cured. In other words, it's chronic. It's also a progressive illness, which will get only worse as long as the person continues to drink or use. Total abstinence from drinking or using is the only way to arrest the disease of alcoholism. Addiction affects the entire family. Indeed, everyone who has contact with the alcoholic addict is affected. And unfortunately, the only person who can stop the alcoholic addict from drinking or using is the alcoholic themselves. Addiction is characterized by the inability to consistently abstain from intoxicating substances, impairment of behavioral control, unmanageable cravings, diminished recognition of the problem, and dysfunctional emotional responses. The disease of alcoholism and addiction is threefold. It's an allergy of the body, an obsession of the mind, and a deep spiritual soul sickness. Everyone knows someone who's addicted, be it to drugs, alcohol, or other substances. It's also probable that everyone has been impacted by someone in their life who is an alcoholic or addict. And even perhaps you may be the addict. Why does a person become an addict? There are many theories as to why a person becomes an alcoholic or an addict. It has been found that genetics play a role. If you have a parent or a grandparent, aunts or uncles who are addicts or alcoholics, it is possible you too may become an alcoholic or an addict. However, there is definitely a component of socialization. Has there been a history of abuse, either emotional or physical? Has there been an instance of poor coping skills? Is there negative thinking? Is there underlying anxiety and depression? It has been found that anxiety and depression also play a part in addiction. Trauma can also cause a person to use drugs or alcohol addictively to manage their feelings or their emotions. Who is affected? Family members, loved ones, and co-workers suffer when an addict is actively in their disease. Addicts become unable to honor their commitments and often lie to maintain their addiction. One of the most serious impacts addiction has is the loss of trust by those around the addict. Lying often becomes the norm. Family members are forced to pretend that all is well, when in fact it is far from it. Because the disease is progressive, the addict alcoholic gets worse, never better. What are the effects of alcoholism and addiction? An incredibly traumatic effect that addiction can have on relationships is domestic violence. Displaced anger and resentment in a relationship where drugs or alcohol are involved can bubble up and explode in violent ways, leading to potentially fatal consequences. If someone is using substances that cause aggressive behavior, small fights can quickly ignite and turn into uncontrollable rage. Those living with people who are addicted to drugs or alcohol experience wildly volatile behavior and are at severe risk of victimization. In turn, the violence can also be exhibited by the person in the relationship who is not using drugs or alcohol. They are angry at the alcoholic addict, and they act out their anger in abusive ways. Both situations are unfortunately common, causing many to suffer in silence due to the shame and fear. So what does recovery look like? The only way an addict or alcoholic will stop drinking or using is if there has been severe consequences, like losing their job, or a spouse leaving, DUIs, or family members refusing to be part of the addict alcoholic's life, or God forbid there's been a serious or fatal accident. Many addicts and alcoholics commit crimes while under the influence, and they do dangerous and illegal things to get their substance of choice that can put them behind bars. By the time an addict alcoholic has crossed the line into addiction, it becomes extremely difficult to stop without intervention. So what are the solutions? The treatment for alcoholism or addiction can include residential treatment, RTC, partial hospitalization, referred to as PHP, or intensive outpatient treatment, IOP. All are helpful in the recovery journey. Alcoholism and drug addiction is considered a disease, and as such can be treated in many ways in order to find long-term recovery. First and foremost, there are 12-step programs like Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Marijuana Anonymous, and Heroin Anonymous. All of these anonymous programs follow the 12 steps of Alcoholics Anonymous, which is based on the teachings of the Big Book. Alcoholics Anonymous was founded 75 years ago by Bill W. and Dr. Bob. These two men discovered that they were able to stay sober by one drunk talking to another, ultimately finding recovery from alcoholism. The first Big Book was published in April of 1939, and the program of Alcoholics Anonymous turns 75 this year. The program of Alcoholics Anonymous is based on total abstinence, as well as a rigorous house cleaning utilizing those 12 steps. And the steps are based on spiritual principles that enable the alcoholic addict to experience an internal shift that clears the way to abstinence and recovery. Once you put the plug in the jug, so to speak, it becomes about emotional sobriety. For many people, the concept of God is a difficult one, but Alcoholics Anonymous encourages the addict to find a power greater than themselves, and it doesn't have to be God. AA is not a religious program, but a spiritual one. It is a complete overhaul of the addict's beliefs, behaviors, and emotions through working the 12 steps of Alcoholics Anonymous. The AA community provides support and guidance to the newly recovering addict alcoholic, and then in turn, the recovering addict alcoholic helps the next addict coming into the program. Part of long-term recovery is giving back and being of service. Alcoholism is considered a family disease. The disease affects all of those who have a relationship with the addict. And those of us closest to the addict suffer the most. And those who care the most can easily get caught up in the behavior of that other person. We react to the alcoholic's behavior. We focus on them, what they do, where they are, and how much they drink. We try to control their drinking for them. We take on the blame, the guilt, and the shame that really belongs to the drinker. We can become addicted to the alcoholic, much as the alcoholic is addicted to alcohol. We too then become very ill. This is called codependency. For family, friends, and co-workers impacted by the behavior of the alcoholic addict, there is Al-Anon or Alateen, which are also based on the 12 steps of recovery. According to the literature, Al-Anon is a worldwide fellowship that offers a program of recovery for the family and friends of the alcoholics, whether or not the alcoholic recognizes the existence of a problem or even seeks help. There's also SMART recovery, which is based on harm reduction. SMART is an acronym for self-management and recovery training. SMART believes that the power to change addictive behaviors resides within each individual and does not depend upon adherence to any spiritual viewpoint. The use of religious or spiritual beliefs and practices in recovery is a personal choice and is not part of the SMART program. There's also recovery coaches and recovery companions that work one-on-one with that recovering alcoholic or addict. You can search online to find out more about this solution. In addition, there is Refuge Recovery, which is a peer-led recovery program using Buddhism as the path to freedom from all addictions. They utilize Buddhist principles and practices to create a strong foundation for the addiction recovery process. Wisdom and compassion enable those struggling with any form of addiction to become more mindful of their mental processes while also developing a deep understanding of the suffering that the addiction has created, as well as a compassion for their own pain. Of course, there's also traditional psychotherapy, where a therapist will help the alcoholic addict address their family of origin issues, as well as investigate any trauma the client has been through. If it is indicated, it is also suggested that the patient see a psychiatrist to address any mental health issues they might be suffering from. Depression and anxiety are commonly found in the alcoholic or addict. Psychotropic medications can help the alcoholic addict manage the mental health issues, if that is indicated, making their journey to recovery that much easier. So, if you or a loved one is suffering from addiction, please call Psych Partners at 949-558-3265 and ask to meet with a therapist. We will be happy to connect you with someone who can help. And I thank you for your attention.